What is the primary vector responsible for transmitting dengue virus to humans? A. Mosquitoes. B. Ticks. C. Flies. D. Fleas. The correct answer is A. Mosquitoes, specifically Aedes aegypti and Aedes albopictus, are the primary vectors for transmitting dengue virus to humans. Dengue fever is caused by a virus belonging to which family? A. Flaviviridae. B. Herpesviridae. C. Poxviridae. D. Coronaviridae. The correct answer is A. Dengue fever is caused by a virus belonging to the Flaviviridae family. Which of the following is the most effective way to prevent dengue fever? A. Cleaning and removing stagnant water where mosquitoes breed. B. Avoiding consumption of spicy foods. C. Increased exposure to mosquitoes to build immunity. D. Skipping vaccinations. The correct answer is A. The most effective way to prevent dengue fever is by cleaning and removing stagnant water where mosquitoes breed to prevent mosquito breeding. In which regions of the world is dengue fever most commonly found? A. Tropical and subtropical regions. B. Temperate regions. C. Polar regions. D. Desert regions. The correct answer is A. Dengue fever is most commonly found in tropical and subtropical regions. Which of the following is a severe form of dengue fever that can be life-threatening? A. Dengue fever. B. Dengue shock syndrome. C. Mild dengue infection. D. Dengue fever with rash. The correct answer is B. Dengue shock syndrome is a severe form of dengue fever that can be life-threatening. What diagnostic test is commonly used to confirm dengue infection in patients? A. Polymerase chain reaction (PCR) test. B. Blood culture. C. Chest X-ray. D. Urinalysis. The correct answer is A. A polymerase chain reaction (PCR) test is commonly used to confirm dengue infection in patients. Which age group is at the highest risk of severe dengue infection? A. Infants and young children. B. Adults over 65. C. Teenagers. D. Middle-aged adults. The correct answer is A. Infants and young children are at the highest risk of severe dengue infection. What is the treatment approach for dengue fever? A. Supportive care to manage symptoms. B. Antibiotics. C. Antiviral medication. D. Surgery. The correct answer is A. The treatment approach for dengue fever involves supportive care to manage symptoms, as there is no specific antiviral medication for dengue. How many serotypes of the dengue virus are there that can cause infections in humans? A. 1. B. 2. C. 3. D. 4. The correct answer is D. There are 4 distinct serotypes of the dengue virus, Day 1, Day 2, Day 3, and Day 4, that can cause infections in humans. Which type of mosquito is the primary vector for transmitting dengue virus in urban and semi-urban areas? A. Anopheles mosquito. B. Culex mosquito. C. Aedes mosquito. D. Ixodes mosquito. The correct answer is C. The Aedes mosquito, mainly Aedes aegypti, is the primary vector responsible for transmitting the dengue virus in urban and semi-urban areas. What is the common name for the severe form of dengue fever that can lead to plasma leakage, fluid accumulation, respiratory distress, severe bleeding, and organ impairment? A. Malaria. B. Yellow fever. C. Zika fever. D. Dengue hemorrhagic fever. The correct answer is D. Dengue hemorrhagic fever is the severe form of dengue fever that can lead to serious complications. What is the recommended treatment for dengue fever in terms of managing symptoms and improving recovery? A. Antibiotics. B. Antiviral medications. C. Hydration and rest. D. Corticosteroids. The correct answer is C. The recommended treatment for dengue fever is supportive care, including hydration, rest, and pain relievers. There are no specific antiviral medications or antibiotics for treating dengue virus infections. What is the term used to describe the process by which the dengue virus is transmitted from an infected human to a mosquito and back to humans during mosquito feeding? A. Reverse osmosis. B. Oral rehydration therapy. C. Vertical transmission. D. Horizontal transmission. The correct answer is D. Horizontal transmission refers to the process of transmitting the dengue virus from an infected human to a mosquito and back to humans during mosquito feeding. Which of the following is a potential complication of dengue fever that can lead to a drop in blood pressure, shock, and organ failure? A. Hyperglycemia. B. Hypertension. C. Hypovolemic shock. D. Atherosclerosis. The correct answer is C. Hypovolemic shock is a potential complication of severe dengue fever, characterized by a drop in blood pressure, shock, and organ failure due to fluid loss. Which organ is primarily affected by severe dengue disease, leading to symptoms such as liver enlargement, abdominal pain, and vomiting? A. Lungs. B. Kidneys. C. Heart. D. Liver. The correct answer is D. The liver is primarily affected by severe dengue disease, leading to symptoms such as liver enlargement, abdominal pain, and vomiting. What is the primary route of transmission for the dengue virus between humans and mosquitoes? A. Respiratory droplets. B. Direct contact with infected blood. C. Ingestion of contaminated food or water. D. Mosquito bites. The correct answer is D. The primary route of transmission for the dengue virus between humans and mosquitoes is through mosquito bites, where infected mosquitoes transmit the virus to humans during feeding. Which of the following is a non-structural protein of the dengue virus that plays a crucial role in viral replication and pathogenesis? A. NSAC. B. A protein. C. Capsid protein. D. C protein. The correct answer is A. NS1 is a non-structural protein of the dengue virus essential for viral replication and pathogenesis. What is the term used to describe the clinical condition characterized by severe bleeding, plasma leakage, and organ impairment in severe dengue cases? A. Hemorrhagic fever. B. Septic shock. C. Multi-organ dysfunction syndrome. D. Acute respiratory distress syndrome. The correct answer is A. Hemorrhagic fever is the severe form of dengue fever with bleeding, plasma leakage, and organ impairment. What is the term used to describe the fever pattern in dengue infections that typically lasts around 2 to 7 days and is followed by a critical phase of plasma leakage and possible severe complications? A. Prodromal phase. B. Critical phase. C. Convalescent phase. D. Recovery phase. The correct answer is B. The critical phase in dengue fever follows the initial fever and is marked by plasma leakage and potential severe complications. Which specific antibody response against the dengue virus is associated with an increased risk of severe dengue disease upon secondary infection with a different serotype? A. IgA antibodies. B. IgM antibodies. C. IgE antibodies. D. IgG antibodies. The correct answer is D. IgG antibodies from a previous infection with a different serotype can lead to antibody-dependent enhancement and worsen dengue severity. Which cellular component plays a crucial role in the pathogenesis of thrombocytopenia commonly observed in dengue fever cases? A. Red blood cells. B. Platelets. C. Neutrophils. D. Basophils. The correct answer is B. Thrombocytopenia in dengue fever is characterized by a decrease in platelet count due to platelet destruction and immune-mediated mechanisms. What is the term used to describe the phenomenon where individuals infected with one dengue virus serotype have a higher risk of developing severe dengue upon subsequent infection with a different serotype? A. Cross protection. B. Serotype neutralization. C. Antigenic shift. D. Antibody-dependent enhancement. The correct answer is D. Antibody-dependent enhancement is the process by which previous dengue infection can increase the severity of disease upon secondary infection with a different serotype. What is the primary target tissue for dengue virus replication within the human body, leading to systemic infection and potential severe manifestations? A. Muscle tissue. B. Epithelial tissue. C. Nervous tissue. D. Mononuclear phagocytes. The correct answer is D. Mononuclear phagocytes, such as macrophages and dendritic cells, are the primary target cells for dengue virus replication within the human body. Which mosquito species is the primary vector responsible for transmitting the dengue virus in rural areas? A. Anopheles mosquito. B. Culex mosquito. C. Aedes aegypti mosquito. D. Aedes albopictus mosquito. The correct answer is C. The Aedes aegypti mosquito is the primary vector for dengue virus transmission in urban and rural areas. What is the key diagnostic method used to detect dengue infection in the acute phase of the disease based on viral RNA detection? A. Serological testing. B. Molecular testing, PCR. C. Chest X-ray. D. Ultrasound imaging. The correct answer is B. Molecular testing, particularly PCR, polymerase chain reaction, is used to detect dengue virus RNA in the acute phase of infection. Which blood cell type is primarily affected by the dengue virus, leading to a decrease in its count and potential severe complications such as bleeding? A. Red blood cells. B. Platelets. C. Neutrophils. D. Eosinophils. The correct answer is B. Platelets are principally affected by dengue virus infection, resulting in thrombocytopenia and potential bleeding complications. What is the recommended treatment approach for managing dengue fever symptoms and promoting recovery in patients? A. Antibiotics. B. Antiviral medication. C. Fluid replacement therapy. D. Steroid therapy. The correct answer is C. Fluid replacement therapy is crucial for managing dengue fever symptoms and supporting recovery by preventing dehydration and maintaining electrolyte balance. What is the term used to describe the phenomenon where individuals infected with one dengue virus serotype have an increased risk of developing severe dengue upon subsequent infection with a different serotype? A. Cross protection. B. Serotype shift. C. Antibody-dependent enhancement. D. Virulence variation. The correct answer is C. Antibody-dependent enhancement, AID, is the process by which prior dengue infection increases the risk of severe disease upon infection with a different serotype due to non-neutralizing antibodies. What is the most common vector responsible for transmitting dengue virus in rural areas? A. Anopheles mosquito. B. Culex mosquito. C. Aedes mosquito. D. Ixodes tick. The correct answer is C. The Aedes mosquito, particularly Aedes aegypti and Aedes albopictus, is the primary vector responsible for transmitting dengue virus in rural areas? Which of the following is a common symptom of severe dengue fever that can lead to organ impairment and life-threatening complications? A. Muscle aches. B. Joint pain. C. Hemorrhage. D. Headache. The correct answer is C. Hemorrhage is a common symptom of severe dengue fever, leading to life-threatening complications such as organ impairment and shock. What is the key diagnostic test used to confirm dengue infection in patients during the acute phase of the disease? A. ELISA for viral RNA detection. B. PCR for viral RNA detection. C. Antibody serology test. D. Blood culture for virus isolation. The correct answer is B. PCR, polymerase chain reaction, for viral RNA detection is the key diagnostic test used to confirm dengue infection in patients during the acute phase of the disease. Which type of white blood cell count is typically decreased in severe dengue cases, leading to potential complications such as bleeding? A. Neutrophils. B. Lymphocytes. C. Eosinophils. D. Platelets. The correct answer is D. Platelets are the white blood cell count primarily affected by the dengue virus, leading to a decrease in their count and potential complications such as bleeding in severe cases. What is the treatment approach for managing dengue fever symptoms and promoting recovery in patients? A. Antibiotics. B. Antiviral drugs. C. Fluid replacement therapy. D. Corticosteroids. The correct answer is C. Fluid replacement therapy is the recommended treatment approach for managing dengue fever symptoms and promoting recovery in patients. Which immune response mechanism is involved in the pathogenesis of severe dengue fever, leading to increased vascular permeability and plasma leakage? A. Cell-mediated immunity. B. Humoral immunity. C. Cytokine storm. D. Innate immunity. The correct answer is C. Cytokine storm, characterized by an exaggerated immune response and release of inflammatory mediators, plays a significant role in the pathogenesis of severe dengue fever, leading to increased vascular permeability and plasma leakage. Which specific antibody response against the dengue virus is associated with an increased risk of severe dengue disease upon secondary infection with a different serotype? A. IgG antibodies. B. IgM antibodies. C. Neutralizing antibodies. D. Non-neutralizing antibodies. The correct answer is D. Non-neutralizing antibodies, which facilitate viral entry into cells without neutralizing the virus, are associated with an increased risk of severe dengue disease upon secondary infection with a different serotype. What is the term used to describe the process of dengue virus transmission from an infected human to a mosquito and back to humans during mosquito feeding cycles? A. Vertical transmission. B. Horizontal transmission. C. Cyclical transmission. D. Transovarial transmission. The correct answer is C. Cyclical transmission refers to the process of dengue virus transmission from an infected human to a mosquito and back to humans during mosquito feeding cycles. Which cellular component plays a crucial role in the pathogenesis of thrombocytopenia commonly observed in dengue fever cases? A. Red blood cells. B. White blood cells. C. Platelets. D. T lymphocytes. The correct answer is C. Platelets play a crucial role in the pathogenesis of thrombocytopenia commonly observed in dengue fever cases.